When you hear the word necrosis, it means the tissue we're talking about has died. So sometimes the fat cells that are grafted do not survive. The body will push it out and it will leak, and they'll say, oh, this person's bone was leaking. So for the complications of surgery, we have documented the more common ones we see in our environment, and we'll be discussing it in this video. First, for liposuction, it is liposuction burns. A burn is an area of skin necrosis. When you hear necrosis, it means that whatever is being talked about has died. So after liposuction, that area of the skin broke down, turned black like a hot water burn. It didn't survive. Sometimes after tummy tuck, if the blood supply to the skin edges is not adequate, that can also happen along the wound, where those areas turn black and eventually die. So that is what a lipoburn is, or skin necrosis. It is common when the liposuction procedure is aggressive, or a very tight garment was worn after the surgery, impeding blood supply to the area, or then when the patient has weak skin. For example, the patient is bleaching or has very poor skin health. That can predispose to the liposuction burns. What is the solution? It is to treat it like a wound, keep dressing it, ensure that it is clean, it will heal. And for some people, it doesn't even leave a disfiguring scar. It is just like a hot water burn, and the skin will heal again and the melanin covers it. So that is one of the most common complications of liposuction. The second one, complication of a BBL, is fat necrosis. Like I said, when you hear the word necrosis, it means the tissue we're talking about has died. So sometimes the fat cells that are grafted do not survive. Not all of them survive. You can lose about 40% of grafted fat cells. When you lose it, your body can absorb it, or then it can turn into a collection of oil or fat cells with pus. The oil is called oil cyst. The other one that is fat cells with pus is what everybody knows as fat necrosis, and it will leak. The body will push it out and it will leak, and they'll say, oh, this person's bone was leaking. It is fat cells and pus, or then oil. So when this happens, we usually tell the clients that let the fat that hasn't survived go. This shouldn't steal your joy or make you unhappy. Many times it's just a tiny area, like a little pimple, but for some others it may be bigger, or it may be a huge collection. For some people, the fat necrosis doesn't turn into a boil. It can just be inside. You can feel a lump beneath your skin that can sometimes be warm and painful. Over time, it resolves and heals. That means your body was able to handle that process of inflammation and necrosis. But for others, it opens up as a boil and it drains. We just encourage you to allow all the dead fat cells that have died drain and go. Put a dressing that is absorbent to absorb it. It will gradually drain and heal without any dent, most times, to your figure or to the area that was sculpted. And perhaps there is a noticeable difference in that area. Allow yourself to heal completely, and then you can consider grafting more fat later there to correct the contour irregularity. So fat necrosis, like I said, if it occurs, all that is needed is wound dressing, a cover with antibiotics, and it will heal on its own. Another very common complication after surgery is what we call seroma. Seroma is just accumulation of fluid, serous fluid under the skin. You see us all the time draining it with needles, massaging the skin so as to express it from the incisions, or just putting pressure so that it will stop accumulating. Seromas are harmless, but they can get annoying when it lasts for a long time. So what do we do when people have seromas? We massage, we drain, we ensure the compression is adequate, and if all these things have been done and the patient is like in the post-op period more than a month or 2 months, we can then offer a service called sclerotherapy, where we drain out all the fluid in that cavity and put something that will help the body seal it off so that the seroma will stop accumulating. So this is a very harmless complication of surgery. It can last for up to a week or 2 in some people. Rarely it can last up to a month, but the body eventually absorbs those fluids and with the right treatment and drainage, it should stop. And finally, complication I like to discuss is what we call contour irregularity. Remember, liposuction or any of these procedures is an attempt to improve and enhance. There is no strict way of achieving perfection. I tell all my patients, striving for perfection means that you will be somewhat unhappy or unsatisfied. So contour irregularities can happen. There may be some minor areas in the body where you feel, oh, this place is smooth, this place is not so smooth, it's rough, especially when people have had procedures like arm or thigh liposuction. Those areas are notorious for having contour irregularities. What can we do to improve or prevent this from happening? Adequate compression and massages. Get the right drainage technique for massages and compression. And when they happen, do not be surprised or quick to be unhappy. Allow your body to heal through it. With time, some of those contour irregularities smoothing out. And if they don't, we can now employ other methods of trying to even out the area. If it requires another minor procedure, we will let you know. So, if you've watched this video so far, I can say that you enjoyed it and you liked it. So I'll say, leave us a comment in the comment section, like this video, subscribe to our channel, and most importantly, share it to any of your friends or loved ones who will be considering undergoing any cosmetic surgery or plastic surgery procedure. Thank you for watching, and we'll see you in the next video. Bye.